All right. Well, look, welcome everyone. Welcome, welcome, welcome. Appreciate everybody coming out on this cold night. It starts to remind me of my days growing up in Buffalo, New York for sure tonight. But I appreciate the fact it's not snowing at least. And I also appreciate the fact that we're here to celebrate positivity, positivity in a major way, positivity in the only way it should be celebrated, through images that represent our Black and brown children, images that connect us with concepts and important things that will transform our lives, images that remind us that it's important for us to work together as family when we think about things like hypertension. And of course, we'll talk more about that. And we have a wonderful conversation happening between Karen Holmes Ward and my lovely wife and author, Dr. Oneeka Williams. So I do have to say this one thing in terms of the introduction, because people often wonder, because I go into these rooms very often and everybody says, yeah, Dr. Anders, you're always smiling, always smiling. And part of it, I immediately say it's because of my lovely wife, and they assume it's, why wouldn't you smile? But the reality, it's because of the positive framework that she's created in our household. It's this opportunity for me every day to be reminded as I look at the things on the wall, as I've not only read the books, but as these characters have come alive in our home, that I'm reminded every day that no matter how big the problem is, there's a solution. And when you go into any situation understanding that, you can't help but smile. You can't help but smile. So today we're going to actually have the opportunity to learn more about how those principles apply to something that we deal with every day at the Demic Center, where we see people come in with hypertension, with kidney disease, with all these things that, quite honestly, we know that there's so many opportunities to improve those outcomes. But when you have conversations with people, you realize many people don't have a blood pressure cuff. Many people, even when they get the numbers, they have no idea what those numbers mean. And then they go to a doctor who very often explains it in ways that makes no sense to them at all. So realize this gap is there. And I'm really excited to introduce my lovely wife, Dr. Oneeka Williams, and the wonderful books that she does as she enters into this concept of the Positive Health Series. And tonight we're going to have Dr. Williams being interviewed by conversation, I should say conversation, not an interview, conversation between Dr. Oneeka Williams and Karen Holmes Ward. Karen Holmes Ward, I'm sure you recognize from Channel 5 and from Cityline, and all the great work she does there, celebrating all of the things that happen in our community. And she's been an amazing, amazing resource, creating a platform to make a difference in our community. And Karen, I thank you for what you do. And I'll thank you in advance for this wonderful conversation that's going to happen tonight. All right. Thank you, everyone.
Thank you, Charles. And thanks everybody for being here. This is kind of a special night for me tonight. And Dr. Oneeka, I want to thank you for inviting me to participate this evening, because I remember when Dr. Dynamo exploded onto the planet. And I think, how many years has it been? 10 years? Yeah, 10 years of Dr. Dynamo. So congratulations. Congratulations to you.
Thank you very much.
Mhm.
Much appreciated.
And you're a Dynamo yourself. Everybody in the room knows that, right? I think it's maybe kind of autobiographical, those Dr. Dynamo books. Do we think so? Tell me, when you first started this 10 years ago, a little more than 10 years ago, what did you hope to achieve by writing these books and continue to bring Dr. Dynamo into new chapters with each new book?
Thank you so much, Karen, for that question. And before we start, I just want to do a couple shout outs. Just thank you, everyone, for being here. Charles has already done the welcome, but I so appreciate the love, the support that has really kind of buoyed and carried me through this journey for the last probably 12 to 13 years. Special mention, I can't mention every single person, but I have sister girlfriends, sorors, Jack and Jill moms, teachers, board members, family members. I want to do a specific shout out to my mom, Eugenia Williams, also known as Mommy Dynamo. And to my
Where is
dad.
Mommy? Where is Mommy Dynamo?
Mommy Dynamo, please stand
Give
up.
us a wave, Mommy Dynamo.
And
Dad
then
in the
to
back?
my dad, Hubert Williams,
Hey.
is Grandpa Willie,
All right.
the back.
Right.
My brother, my twin brother, Hubert, Uncle Hubes, is also in the room. And if you're kind of getting the theme, this is, kind of a family affair. And it's a community affair. It's a village affair. And that has been kind of one of the guiding principles around Dr. Didi Dynamo, is that recognition of the values of family, the values of community. And when I started Dr. Didi Dynamo, when I conceived of the idea, it was really meant to inspire girls and children of color to believe that there were really no limits to what they can achieve, to have them live out Dr. Didi Dynamo's tagline, which is that not even the sky is the limit. And that was born out of my own experience. You'll kind of see threaded throughout that storytelling is a huge part of what I do every day. Patients, I listen to their story. I weave it together in a way that helps me to understand what they're going through, what their diagnosis, and then to understand the context in which I'm going to help them. And as a journalist, my dad has really embedded the love of story and the love of science. My mom is a science teacher. And so it all came together with this, having gotten myself to an all-girls school in Barbados, wanting to do medicine, and being told that I actually didn't have access to physics, which was one of the prerequisites. And so for the first time, my parents had raised my brother and me to basically just neck and neck. We were always exposed to the same things, had the same expectations. And I got into this school where I wanted to do physics, and I was told that girls don't do well at physics, and so it was not available. And so for the first time, I had encountered
How old were you when that happened?
I was 13. And so I encountered this limit. And
Did it have an impact on you emotionally?
Without question. One of the things, certainly advocacy, parents said we were not going to accept this. And that helped me. When you think about this positive philosophy, it started with this can-do attitude of course you're going to do physics. And that's what happened. I marched into the all-boys school where my brother was a student in the class as the first girl in their high school, the all-boys high school, not just to do physics, but to do the rest of my high school education.
So we all know you're smart, you're brilliant. What was it like for you being the only girl in that school?
Well, it was a great confidence booster. I mean, we were all hormonally charged, and it was like bee to honey. I mean, everybody was in love with me. Literally.
How could they not be?
But what it really taught me, the experience in being able to, number one, set boundaries. Number two, see our commonalities, which really transcended our differences. And as we explored each other's idiosyncrasies, each other's differences, we had this uniting purpose and goal, which is that we all wanted to do well. We were there to do well.
So the academic competition, did the young men in the school, while they were admiring your beauty, did they also admire your brain?
Well, this was the interesting thing, because when I first went into the class, and one of the boys, now men, I reached out to him. He kind of communicates back and forth on Messenger. And I said to him one day, I said, what did it feel like when this girl came into the class? Were you all supportive? And they said, well, you were eye candy. And we didn't want to be in an all-boys school. And so they thought that I was going to be their plaything until the first math test.
When you kicked their butt.
I kicked their behind. and that it was a whole newfound respect, and it changed their kind of respect and their understanding that girls are no different from boys. We're smart, we can show up, and we can do things in the same way that they can.
Now, your brother was in the school as well?
My twin brother was in the school, and he was very clear. You're on your own.
Oh,
Like, you have to figure this out. Everybody's in here, sleeves rolled up. There is no babying happening here. We are in this together, but you have to carry your weight because you're going to have to learn to deal with all these guys. And I can't really help you with that.
Okay. All right. That's good.
Yeah. But it made me, it helped me to stand on my own 2 feet, and it toughened me up.
So much of that toughness we see, and that determination we see in Dr. Didi Dynamo in the
Yes.
books.
Absolutely.
Mhm.
Absolutely. And she is really an alter ego. I have pulled the things that I understood that were so pivotal for me, and facing the type of landscape where girls didn't see themselves as scientists.
Mm.
By the time they're 6, Columbia did a study that said girls don't believe that they could pursue careers that require brilliance, that their images, when they choose and they drew pictures of what a scientist looked like, they drew old white men with spectacles. And we saw this reflected in the percentage of women in STEM fields. And so because of that, I realized that I had had this experience because I was called to do this work of presenting this counter narrative and using my own story. And that when we are able to use our stories, our own experiences, to then impact and deliver messages, I think they're much more impactful because they happen from a place of our own journey, which then helps to inspire, encourage, and identify those places where people need to hear that you can do it. And I know that because I was in this situation and I've done it. So therefore, can you?
Now your work is obviously, let's applaud that. Let's applaud that for sure. Your work obviously is still in progress. I'm sure there are many more chapters in the life of Dr. Didi Dynamo. But as you look back on this first 10 to 12, 13 years, tell us how you feel. Do you feel that you've accomplished? What have you accomplished through this effort?
I'm very thankful. What am I? I was going to say proud, but I'm thankful and proud of the journey and where Dr. Didi Dynamo has come. She has evolved because it started in STEM and her on the island of positivity with this not even the sky's the limit belief. And I'm a firm believer that it first starts in the mind. So my mission was to change the way the children think. Because once you think it, if I can get you to believe that there are no limits, then it impacts how you feel. Now you're filled with hope and you feel empowered. And then once you have that feeling of hopefulness and being empowered, then you can act. And now you can act and you can take steps to make a difference in the world, to actualize. You get to the top of Maslow's pyramid where now you can self-actualize and now you can touch the world. And so having the journey of understanding how important that mindset is, I started with the positivity and I think that was just a divine download, but I didn't really understand how important it would be, not just for children, but for adults as well, not just for the academics, but for our own physiologic and our physical well-being, not just for our physical well-being, for our mental and emotional health, that this belief that there are 5, what I call a process, and I believe that positivity is a process, it is not a platitude. And so because of that, if you have a process by which you can train the way that you think, it impacts on everything else. And so that is how Dr. Didi Dynamo has evolved into stepping into the fullness of this understanding that what that mindset does. And so I have been very blessed and thankful to have been on the journey where her mission has expanded. It has expanded not just to, the children. And one of the things that I think for me has been really, really transformative with Didi is She came packaged in as a Black girl, so externally facing the importance of the diversity and the gender. But internally, she represents characteristics of all of us. And so when I see white boys boot up with the book and they don't want to let it go, and they are just as fascinated and they're just as connected to Dr. Dee Dee Dynamo as the little little Black girl, the little Black boy, what that says for me is that this internal connection becomes the fertile soil where we begin to dismantle unconscious bias, because that connectedness, that feeling that we are the same, permeates who she is and her world.
If I could quickly share an incident that happened to me last week about impact. We worked with a makeup artist by the name of Lynn Avalone. She is a white woman, and she did the makeup at the DIMIC virtual fundraiser a couple of years ago. Okay, so last week she was doing some makeup for us for another job, and she came in. She was a little bit frazzled. I said, "Oh, how's your morning going?" She said, "You know what? I had a crazy morning, but I went to my island of positivity and I just chilled out." She said, "Whenever I take my yoga class, I go into the island of positivity." She said, "I never forgot what Dr. Oneeka was saying at the Demick Health Center." So you just never know. You never know who you're going to reach, right?
Absolutely. Absolutely.
You know, Dr. Dee Dee is taking on a new challenge, the Hypertension Takedown. Tell us about the Hypertension Takedown.
As all of you know, the pandemic shed a spotlight on health in Black and as you know, the pandemic shed a spotlight on the health of Black and Brown communities in a way that exposed these things that had been underlying, that had been present, but had never really fully been attended to. And with the disproportionate impact of so many of these chronic diseases and chronic illnesses on our communities, there are a couple of things that really bubbled up for me. Number one, that this is part of a personal journey, that I was a statistic. I am a statistic.
I am too.
Right?
I have high blood pressure. How many people in the room have high blood pressure? Show of hands.
Yep.
Yeah, quite a few.
Yep. And so it became clear to me that there's so many ways in which we need to respond to this in a way that creates relatability, accessibility, and as such, change in behavior. And through the lens of education and equity, what I began to realize is that this hypertension is not just something that affects Black and Brown communities in this country. Globally, hypertension is one of the #1 killers. It is the precursor to cardiovascular disease, to strokes, to kidney disease, and that around the world, it is known as the silent killer because more often than not, 9 out of 10 people will walk around and not know that they have high blood pressure. And guess what? What are the countries that are most adversely affected by hypertension? They're the countries that are in the developing world. They're low socioeconomic countries. And those are the countries that have a large representation of Black and Brown people. And so, I began to think to myself, if we all know that hypertension is a killer, we have February is Heart Health Month. We have PSAs, we have ads, we have things on the buses, you go to your doctor's office, there's all this information. And in spite of that, we still don't seem to have the opportunity or the ability to make a dent in this issue. And oh, by the way, the incidence of pediatric hypertension has doubled in the last 10 years. And just last weekend, I met a Black mother whose 10-year-old daughter has high blood pressure. And I met a mother of a Caucasian student in Mark's class who's 17 years old, male, who has high blood pressure.
It must be some sociological connection.
Well, here are the 5 things: stress, diet. The 10-year-old predominantly diet. She has food, kind of, some disordered eating.
Fast food with high sodium.
Fast food with high sodium. And so obesity, so elevated weight, type of diet, elevated salt, stress. Our kids are under a lot of pressure. We live in a world that's very stressful. Lack of exercise. And then family history. It's a real thing. And so if you put these things together, we are seeing more and more. And so consequently, the opportunity to really begin to have a disruptive way of delivering this information so that now people can look at it through a different lens, families can look at it through a different lens, and it begins to introduce into the home behaviors and choices that help them to be the healthiest versions of themselves.
How do we encourage people in our communities to get checked for hypertension?
Well, first of all, we demystify it. We make it a topic of conversation in homes, and we make available blood pressure cuffs in homes and make it part of normal behavior to check blood pressure as a family, from the youngest to the oldest, at least once a week. It's just changing behaviors, but you have to present it in a way that is relatable, that brings, hypertension and high blood pressure is a very abstract concept. And my belief, and as I have seen in the books in which they have been embraced, it makes a difference when you can bring characters to life, and that when you bring them to life, it sheds the spotlight on the issue in ways in which people will say, oh, now I get it. Most people don't get it. Most people don't get it.
How is Dr. Didi Dynamo telling the story? How are you using her voice to help change this?
So her voice is, the story is set at the Island of Positivity Beach Party, and Grandma B is cooking up her mac and cheese, ribs, and potato salad, and they're waiting for Grandma B to get there. Yeah. And she's taking a long time. And so for those of you who know the Dr. Didi Dynamo world, there's an alarm that is sounded from Gordon the Gullible Globe that says he can hear the organs in Grandma B's body complaining. The heart is hurting. The brain feels as if it's about to explode. The eyes are feeling blurry. The vessels feel like they're just being decimated. And Dr. Didi says, it must be that monster hypertension attacking Grandma B. So now they head off back home to find Grandma B in the throes of this hypertensive attack. And so Didi, as you know, when she goes on mission, she has her teams, she identifies the problem, she has a solution. And so this is how Didi approaches it. But she then enlists a number of other team members: Mindful Mindy, Stress Buster, Exercise, Low Salt. And so she has all of the elements that are part of what is required for you to maintain normal blood pressures. And it is through her work and bringing the team together and giving voice to what it is that needs to be done in order to support Grandma B. And of note, one of the things that Grandma B says, when Dr. Didi says, Grandma B, what happened? She said, Dr. Didi asked her, did you take your medication? And she said, I didn't, because I was feeling fine. And that's a lot, very, very common. I'm feeling fine, so I don't take the medication. And then she said, well, I don't like to take it because it makes me feel dizzy. And so patients commonly complain of side effects, and they complain about, they say, oh, well, I feel fine, so why should I take it?
But it is the silent killer.
It is absolutely the silent killer. And so for people, it's within the book, there are a number of poems, and Hypertension says he's because I'm sneaky. You know, I ride along on a wave and as I take the organs out because I'm sneaky. And that is exactly right. You don't know you have a problem until Bart gives a shout. Bart is the blood pressure cuff because I'm sneaky. So Bart now has, Dr. Didi now empowers Bart to be on, to arm all of the children in the community to have blood pressure cuffs, so that they now are on patrol. They are the vectors that take both the detection and the behavior changes into their families.
Tell us more about how people in the room can spread Dr. Didi Dynamo's message. What can we do to bring her voice back to the people that we know?
Tell everybody that you know, read the books and begin to practice for yourself these recommendations. First of all, each of you should have a blood pressure cuff. Charles will tell you, if you look in my bag right now, I don't go anywhere without my blood pressure cuff. And how many times, whether I've been on a plane or wherever, I've had to pull out my blood pressure cuff and check someone else's blood pressure. So I'm not saying to be as anal and have a blood pressure cuff in your purse, but you should have it in your home. And so begin to practice, begin to have the conversations with your family. How many of you have family members who I don't want to be on medication? I'm not going to be on medication.
I was one of those people. I didn't want to start taking medication because once you start, you can't stop.
Don't think you can get off of it. And people feel of it as a weakness. And I can tell you that our lives, the stress of our lives, are a huge factor in the blood pressure. I mean, when I go on vacation, I don't have to take any blood pressure medication. But if I'm running around, 100 miles an hour, then my body is on high alert. All of the cortisol, all of the hormones that kind of help me to keep going, essentially creates that elevated blood pressure. So part of what we have to do is to learn those techniques and practices: breathing, tapping, meditation. There are ways in which we can retrain our bodies. We can retrain our internal systems, but we have to be aware. So any place where you can take the message, where there are places where that people need to hear this, have a book club in your home. Invite me to come speak. Come to your organizations, put it out on your social media, anything to spread the word. In schools, we have a lot of teachers in the room. Invite them into your schools. Have it be lobby to have these books be part of your health curriculum. They really are very engaging. And before, Karen, before we just kind of finish up, speaking about into schools and being engaging and how kids, students and teachers respond to the Dr. Didi Dynamo books and the mission of Dr. Didi Dynamo, I would like for you to take a look at just a video presentation. This is the work of the Banneker School, where Mommy Dynamo is a curriculum coach. And so they have been using the books for 5 to 6 years, or probably almost 10 years, really. And so here are just some of just want to show you some of how the books from kindergarten all the way through the 6th grade, how the books are used within the schools. Yes, compliments of our wonderful videographer, Zach Nolan. Thank you, Zach.
We're going to take some questions from the audience, but I have to ask you, mother, wife, doctor, author, star of videos. How do you keep it all together? How do you keep your island of positivity and make sure your blood pressure doesn't go up?
Karen, I get that question so often. And I think that for me, it is really a grounding in God. It's God's grace. It's an understanding that this is a divine calling and mission, and that I have all these elements of self-care that I have actually gotten much better at following. So that left to me or to my druthers, this has been a 10-year journey. And when I started, my vision, or I think the vision that God gave me, was that this was going to be a household. Dr. Dynamo would be a household name, and it would be bigger than Dora the Explorer. And I haven't gotten there yet, but I have had to be patient with myself. I've had to extend myself grace, and I've had to trust and believe that staying in the present moment, and I do that often, is that I stay in the present moment. I am passionate. This is exciting for me. I actually love this. I think that my creativity is one of my superpowers. And my, Charles and my, girlfriends will tell you that I enjoy, I talk on the phone, we travel, like I do lots of things that bring me joy. And if it doesn't bring me joy, then if it's not adding to me, then I have gotten much more intentional. So when I wrote the book, Knock Today Negativity, and I speak about positivity, it is literally from this perspective of, number one, being able to extract the good in every situation. And I'm able to do that. And so because of that, it gives me this overall, I think, just kind of flow. I think I'm really in
Peace,
flow.
an internal peace.
And an interior peace. And so, I do what I can, the best that I can.
But wait a minute, there must be some days when all of your worlds collide. What do you do on those days?
Usually that happens often. But here's how I don't meet their deadlines sometimes that I don't meet. And one of my Achilles heel is that I am probably chronically 15 minutes late, pretty much. And so, in my book, I have said it, that it's just one of the things. And it comes from a place of optimism, where I think I can get so many things done before it's time to get to where I need to get to. And I'm not advocating, especially for the young people in the room, that should be how you approach life. And I'm always trying to do better. So my medical director of my practice came to me last week, and he said, I'm usually 15 minutes late to the office. And he said that the office manager came to him and he said, could you talk to Dr. Williams about, could she come on time? And I said to him, Steve, you read my book, right? What did I say? I said, I'm always 15 minutes late. And I said, and I'm always trying to do better.
So the office manager should book the patients 15 minutes later.
And I said, it's not that I accept that I could not improve. I said, I really am always trying to do better. So I'm usually on time or a little bit early for the OR, because if you don't get to the OR on time,
then that's another problem.
And then for the patients, I've kind of figured out that it's probably going to be 15 minutes before they're ready to see me anyway. So, but I told him, I said, I really am trying. So these are things that I recognize that I can't really do everything and do it at a standard necessarily where I'm going to show up on time all the time. But I kind of accept that, there are just some things that will end up not being perfect. And that's
kind of your pressure release valve.
And it is
that 15 minutes. That's your pressure release valve.
It is. And I have good intentions. Every day I really am planning to be on time. But by the time I do the podcast, I really am. But when you speak about worlds colliding, one of the things that is really, for me, such a blessing about doing this work is that I actually patients don't complain when I'm late, because they know that when they get into the room with me, that they're going to have just an amazing patient experience. And so my patients usually have so many other kind of interesting facets of what's happening in their lives that become a part of our conversation. And so when they need to be encouraged and they need a positive perspective of something that has nothing to do with urology, I take the time to do that. And so I am able to infuse this work in so many different ways that has been such a blessing. And I just want to make 2 points from the perspective of even some of the things that you saw on the video. The first is that the Dynamo world is about creating a relationship, especially with young people and kids, with Dynamo and with the world, with her world, that really helps to transform the way that they think. And so over the weekend, last weekend, I met a mom who came to me and she said, I've never really spoken to her much. She came to me, she said, I walked into my daughter's room. We bought the Dynamo books about 8 years ago, and they were her favorite books when she was 2 or 3 and 4. And she said, as she's 10, I walked into the room and she had the Dynamo books laid out on the floor. And so she said, well, what are these books doing on the floor? And they were the space books. And the daughter was like, well, duh, they're my favorite books. And so she said it was really amazing for her. It was such a touching moment that her daughter at age 3, these were her favorite books. And that at age 10, she is still extracting something from the books that make them her favorite books that she goes to bed with. And then fast forward to Mark, who wrote his college essay, and I did not have any involvement with his college essay. And so went with the initial draft. And when he showed me his college essay, the supplemental question was, what are you going to contribute to the school of this particular school? And he started the story by saying that he was devastated when he found out that Pluto was not a planet. And when he asked why wasn't Pluto included he had a comforter that had all the planets and the solar system, and Pluto was not in orbit as a planet. And when we explained that Pluto was not a planet anymore, it had been downgraded to a dwarf planet, he was 5 and he was just heartbroken. And he said, instead of allowing him to just stay sad and think that there was nothing that could be done, he said, my mom wrote a book about Pluto being downgraded and creating a perspective so that he understood why Pluto was downgraded. And then Pluto at the end chose to, Dr. Dynamo, helped Pluto to become a planet again. And then at the end, Pluto realized, you know what, I'm actually content being a dwarf planet. And so for him, he realized that Pluto did not have to be a planet for him to be happy and for Mark to be happy. And so Mark said that what he will take to his university is these 5 habits of positivity, that when he gets up in the morning and he looks at the 5 habits of positivity, it informs how he deals with his day. And it is really true. I mean, we look at this boy and he bounces back. He's the comeback kid. No matter what you throw at him, he is able to shift into this perspective that is a positive perspective. So to see that it has had impact on him throughout his life, and it continues to inform as he will head off into whichever university he attends, that he sees the value to bring that into a space that others can benefit from what he has benefited
She
from.
transitioned from Dr. Oneeka to Mama Oneeka. Yes, proud Mama Oneeka. Let's take some questions. Does somebody have some questions you'd like to ask? Kristen, I know you have some questions. A question.
As a friend, as a sister friend, as a mom, I'm so inspired by Dr. Dynamo. And I want to know, hypertension, takedown, number one, will you come to my house?
Absolutely.
And 2, what do you hope that children walk away with in their level of comprehension? What should they walk away with?
What I hope that they would walk away with is that there is always a solution, that we are empowered to make decisions that make a difference in our lives and in the lives of those around us, that they feel Dr. Didi Dynamo's energy and they are charged up to be leaders, to do something to help someone else.
Dr. Williams, Oneeka, I'm always amazed every time I hear you talk, just how interesting you think it's about a children's story or a character, but you're really informing so many just adults. And one of the things I found interesting, my question is if you would consider continue to talk to adults, especially people in the profession, around just perspective taking and also ways in which we translate language to make it more accessible. I know when you came to UMass Medical School and you spoke to our community, it was so insightful. And many people thought you were going to talk about a children's book, but you're really talking about a professional practice, a way to engage audience. And so my question is there a possibility ahead for a TED Talk or in other spaces where you're talking to adults about how do we engage and really take these complex ideas and make them really accessible?
Thank you so much for that question, Fred. I mean, you have literally hit the nail on the head. And we live in a time where lines are blurred, labels are being dismantled, boxes are being blown apart. And so this notion that a children's book is a book that cannot be appreciated by adults, that a children that learning is divided into children or adult learning. Information and knowledge is accessible however you can access it. And so for many of us who are visual learners, whether you're a child or whether you're an adult, visual learning is very, very important in how you acquire and you apply information. And so having this understanding that the presentation of this information that is meant to transform the way that you think, it is how can you access the information, whether it's in a picture book that we may think is a children's book, but now we know that things are fluid. So there's no longer this need, I think, to have these very rigid and fixed lines in terms of how we think about things. And and with that in mind, I want to introduce you to Madam Sodium. And when you're talking about how can you take this character that appears to be a children's book character and that is speaking to children, and what is it that an adult can take away from this? So Madam Sodium is salt and is, for as we've just discussed, is kind of the bane of existence when we think about blood pressure and elevated blood pressure. And so we could look at Madam Sodium very negatively. She brings into our health space something that is very negative. Or we could look at Madam Sodium as someone who is misunderstood. So Madam Sodium is my favorite character. And I think Madam Sodium has so many similarities with many of us. So this is what I love about learning, lifelong learning and teaching. So Madam Sodium, I don't know if any of you know, sodium in the Roman times era, sodium was a currency just as valuable as gold. Workers were paid in sodium, in salt. So first of all, you could well imagine this fall from grace, this change in relevance, this complete loss of her glory. So she used to be the cat's meow. Her value was significant. And so when we think about what we lose as times change and how that impacts us significantly. So we might think of ageism, right? We might think of where do things in our life change, where the prominence and the status that we had at one point in our life changes and how we respond to that. So that's number one. Number two is before refrigeration, sodium was how food was preserved. You needed sodium and salt in order to feed your family on a day-to-day basis. And so there again, having come out of some place where you feel that you have been so important in people's lives, and now you're at a point where they no longer value you, and actually they say bad things about you. And so it is not, it is not sodium's intention. I don't think sodium sets out to really want to make you unhealthy, but sodium is really trying to kind of assert her relevance and her value. The other thing about sodium, and and this is what I love about science, and Mom will tell you, is that sodium has a kind of an identity crisis, because sodium can raise the point at which ice melts, and that's how salt is used. Am I right, Mom? Oh, I'm sorry, lowers, yes. Sodium lowers, sorry. That's why I have to check with the science teacher. Sodium lowers the point at which ice melts so that it's used in ice and so on and so forth to melt snow. And then it raises the temperature at which water boils. So how can you have something that's lowering the melting point, but then raising the boiling point? Like she's conflicted. So I just think, so when I kind of get into these characters in this way, you can kind of see the adult applications in how you can have a conversation about when things change, when your life changes, when your relevance change, how do you deal with these type of issues? And how is sodium dealing with the fact that they no longer have the prominence in our lives? And so it's those type of, and we can have that conversation about almost all of the characters in the book. It brings you into this place of absolute perspective taking, empathy, that even in the most negative of characters, you can find empathy and you can find compassion. And so because of that, it allows for us to have these rich conversations as adults, to be able to extract all of these elements that are a part of our day-to-day experience.
Well, I must confess, I never thought of Madam Sodium in that way until just now.
Yep.
Thank you for that.
And she's not, and we still need, our bodies still need a certain amount of salt. It's still, if you look at the if you read the labels, how much sodium is in our foods? A ton. So she's still needed, but we have to take control, like everything else in our lives, of how much of her we use.
Yes.
Books intended for children. To what extent do you think that the contents of your book would help to bridge the racial divide in society?
I think that it has a huge impact and opportunity to bridge that divide, because children are sponges. We surround our children with belief systems, with images, with information, and that's their view of the world. And they build knowledge upon knowledge. I mean, the Piaget theory of childhood development is children's knowledge builds upon knowledge, builds upon knowledge. So if we can't necessarily chart the course for the adults, but we can expose our children in a way that helps to level the playing field, helps to open up their worldview, and helps them to find the inner connectedness where we're more alike than we are different, then I think this will have a huge impact on bridging that racial divide.
Dr. Williams, would you have any words of wisdom to close out this fabulous conversation and book talk?
I truly believe that each of us has everything that we need to make a difference in someone else's life. And that connectedness is really what keeps the world going. We're all interconnected. And so if we can approach our lives from this perspective of how are we going to, number one, add to our life, how are we going to add to others' lives? And when we are faced with the negative experiences, that we still are able to extract the things that serve us. I truly believe that we have that power. And I can tell you, as a Black female surgeon, I deal with this day in and day out, where people make assumptions about who I am, about what I do. We have, I'm sure many of you in the room have these experiences in so many different ways. And the way in which we respond asserts whether we're going to give our power away or whether we're going to keep our power and use that power to change the way someone else thinks. And we have that power, embrace it, use it, and help our children, the generations coming up behind us, to own their power in that same way.
Dr. Didi Dynamo, Dr. Oneeka Williams.